So the next presentation will be given by Suzanne Brundage, who will talk about some of the work that the United Health Fund has been doing under the Medicaid Early Child Innovation Lab. Ms. Brundage is the director of the Children's Health Initiative at the United Hospital Fund, which has been working with the Center for Healthcare Strategies Medicaid Early Child Innovation Lab, a mouthful, to explore ways that the Medicaid can align with other early child sectors to better address the social determinant of health needs of high-risk families. In particular, the United Health Fund has provided technical assistance and policy expertise in partnership with the New York State Department of Health to implement initiatives of the Medicaid Early Child Innovation Lab. Welcome, Ms. Brundage.
Great, thank you so much. And it's a pleasure to be here. I think a lot of what I'm going to say is going to build on the themes of the prior two presentations, which were fantastic. So the work that I'm going to talk about is the first 1,000 days on Medicaid initiative. So I'm going to move us into a conversation about really how a state policy can build on the themes and the concepts that we've talked about during the morning session. So it's really going to be a conversation about political will, policy development, and practice. And the United Hospital Fund is an independent nonprofit organization. We go by UHF for short. Our mission is to really improve health and healthcare for New Yorkers. We have a contract partially funded by the state to give particular assistance to the Medicaid program to help it achieve its aims. And so as such, for the past few years, in addition to doing research and policy analysis, we've really become a staff extension in some ways to the state Department of Health, particularly around their children's agenda. So we work very closely with the Department of Health. So 1 year ago, the then Medicaid director of New York, Jason Helgerson, stood in front of a very large group of people, about 500 people at a conference, and announced the new focus for New York's transformation efforts. And that would be on the first 1,000 days of life for children, roughly ages 0 to 3, when Medicaid plays a particularly large role in those children's lives. And the notion that he unveiled, and we'll walk through that, but the notion that he unveiled was that the Medicaid program is really uniquely positioned to set a foundation, to set a foundation for lifelong health and reducing health inequity by focusing on social determinants of health, brain development, and other domains of development, particularly social emotional development, and really driving cross-sector systems improvements. And so this is why I sort of say that the first 1,000 days on Medicaid initiative is really a Medicaid-driven cross-sector approach to improving outcomes for children. And at its core, it's basically an initiative that is a set of 10 projects, and we'll talk about those briefly, that were selected through a very intensive, robust, 4-month-long stakeholder process, so a fast policy cycle that included practitioners spanning health, education, mental health, child welfare, child advocacy. And the initiative was announced last August. It was designed through the stakeholder process through last fall. In January, it was embraced by Governor Cuomo as a State of the State initiative. In April of this year, April 2018, it was enacted by the state legislator, seed investments over a 2-year budget to invest in these 10 projects. And now the initiative is at the very beginning stage of implementation, which includes sorting out the exact evaluation approach that's going to take. So just to ground you where we are in the timeline, we're really we know what the initiative is and we're moving into implementation. So there we go, excuse me. So the 10-point plan in brief, I think the committee received policy proposals in their packets. So behind each of these projects is basically 2 to 3 pages of material that really outlined for the state what the full idea was. But I put this up here to give you a sense of course, what the initiative is going to be. And it's really a diverse set of projects that were tailored to try and fill in gaps in the New York State landscape, either by scaling programs that were believed to be particularly effective at reducing health inequities, but primarily by starting to address some of the funding and measurement gaps that we see in the early childhood space, and then to really use the Medicaid role as a way of building, kind of encouraging cross-sector cooperation, both across agencies and within local communities. So I want to touch a little bit on the features of the process, really how we came to building this 10-point plan, because I think really the process itself led to a lot of the political will that then resulted in the initiative becoming a state of the state initiative and embraced by the legislator. So notably, this was a Medicaid-driven process, but health education leaders were put at the forefront of it from the very beginning. So it was chaired by the state education commissioner and a higher education leader. That was an intentional choice by our Medicaid director to make the face of the initiative education. So being more outwardly oriented rather than talking about social determinants of health, really what can Medicaid and health do to contribute to the education sector by working in the early childhood space. It was a public process, so there was a work group, but the work group was an open invitation to any member of the public that wanted to join. So what that meant is we had a very big table of people who were invested in the work, and we had 250 plus people by the end of the process, really contributing ideas, raising concerns, refining the concepts. And so that was really a kind of a crowdsourced approach. We started in our first brainstorm, people came to us with well over 300 ideas, problem areas they were seeing in the early childhood sector, and we worked people through a process to find large areas of consensus and agreement of where there were real systems challenges that Medicaid might help with. But I think most importantly, especially for this group, is, a lot of people can identify challenges they see on the ground. It was really key that we had leadership in the form of United Hospital Fund and form of other people that served as chairs to translate potential solutions, promising interventions into specific policy that Medicaid itself could start to drive within the statutes of the federal program and the state program. That's very complicated work. And so I raise that because I think that's something that, other states can start to replicate, building up that expertise among policy institutes. And then we used a public process of voting and ranking the proposals as well. So we had 5 clear criteria for every proposal that made it into the final plan. It had to be affordable. That was somewhat of a vague term, but set out by the Medicaid director for understandable reasons. Had to be feasible, so Medicaid program had to be able to drive the change. Had to be cross-sector. Every proposal had to be cross-sector. Had to be evidence-based, and then it had to have a large population health impact and or be highly kind of believed to be successful in driving down disparities. So I think some people might be wondering, how is it that a Medicaid program came to kind of have this perspective or such an interest in early childhood? And if you take away nothing else, I think it's really this slide that I want people to focus on. To start where we were about a year ago in New York, it was very clear that essentially the word had gotten out about the science of early childhood development. So what you started to see is that other parts of the healthcare sector, broader parts of government started pointing to early childhood as a real opportunity for influencing life course trajectory, not just in health, but across a broad range of outcomes. There was also a period of great innovation in the Medicaid program that really opened up the Medicaid program to looking at how it could do things differently by focusing really on delivery system reform, payment reform. So there was a willingness on the state side. And then there were local collective impact projects similar to what we just heard about that really were providing the theory of change, saying that at a local level we can demonstrate these sectors coming together, working towards shared outcomes, can be successful. They can provide data about where there are health inequities or other inequities in service access, and that the Medicaid program can really replicate that degree of collaboration and can learn from it. And so I mentioned that the Medicaid program had been in a period of innovation prior to this. You know, one of the foundational things that happened in New York was we had discussions about value-based payment. And we were trying to figure out what does value-based payment mean for the children's sector. That's a complicated topic. We don't have time for it in full, but where it very quickly led us was a conversation about what are the outcomes we're trying to achieve in the healthcare sector. And when we really worked it through a large group of people and put it on paper, we shifted from a conversation about trying to impact individual healthcare measures to much more broader goals around child well-being. So I highlight here optimal birth outcomes for children and mothers, secure parent-child or caregiver-child attachment, and then children being developmentally on trajectory by school entry. And those, just as Rob had presented, those became as a matter of state Medicaid policy, our big goals that we were oriented towards. So this has become known as the North Star framework in New York. It drives all New York Medicaid, child related decisions at the moment. And those goals carried over into the first 1,000 days effort. And what was clear as the Medicaid program directors and others listened to this conversation, they started to see how Medicaid alone doesn't own these outcomes and needs other sectors and can contribute to other sectors in both achieving and measuring these outcomes. And the other really key component was Medicaid has a huge role to play in those first 3 years of life. New York, 59% of children ages 0 to 3 are covered by the Medicaid program. There's no other single arm of government that connects with those children in those early years. Certainly shifts over time as the education program takes hold. So this was just the rationale. This is basically a summary of those 4 points, and that was the rationale that was introduced to the public as they started to think about first 1,000 days and Medicaid's role in this perspective. So the committee asked, how did the concepts of sort of early childhood development science, health equity feed into the initiative? Say at our very first brainstorm of the first 1,000 days work group, we put up these outcomes that I just discussed and then presented basically the work of the Harvard Center on the Developing Child back to the work group, and kind of acknowledge that while the outcomes we're trying to achieve can be very hard to measure at this point, particularly at a state level, what we were asking the work group members to do was at least embed their suggestions to the Medicaid program in this evidence base to give the Medicaid program some confidence that they were moving in the right direction, and certainly as our own measurement systems kind of catch up and are able to capture these outcomes at a more nuanced level. The other key feature of the first 1,000 days initiative, as I keep saying, is being cross-sector, so grounded in the brain science, but really aligning with other sectors. And I could identify, as I thought back to the process in each of the proposals, at least 6 ways that our Medicaid program is demonstrating that. So one, as I mentioned, is really just at a fundamental level embodying collaboration between health leadership and education leadership. These are 2 biggest parts of state government budgets. But they're also usually very busy leaders, rarely sit in the same room. We had them in the room together consistently through this process saying, we are serving the same kids. So there may be a budget impact on your side or my side, and over time it's going to go back and forth. These are the same kids we're serving. And then we really thought about that key school readiness outcome as the point where both education and health have a shared interest, that kids around age 3 in New York through universal pre-K, really could have joint interest in making sure that kids hit that milestone, and so targeting our work to that. We put in all of the proposals a few cross-sector requirements. One, that other sectors are invited into the Medicaid policy deliberations that are part of the initiative, that all pilots to be eligible for Medicaid funding, managed care plans and healthcare providers have to bring in the community to be eligible for pilot funding. And we think now it's likely as we move to implementation that all of those pilot recipients will receive training and cross-sector collective impact work. And then finally, we really encourage the teams to think about using all available Medicaid levers. So not just what can Medicaid pay for, but again, how can they drive system change by being kind of a champion, by educating healthcare providers, by being a convener across state government. And I know I'm over time, but I'll just say, so this initiative was about a population level impact for all low-income kids on Medicaid, but we did try in the proposals to put health equity into each proposal. Where there was strong evidence that a program reduces disparities, we put that into the criteria for people to then rank. We also recommended targeting a lot of the pilot proposals specifically to communities with poor birth outcomes, big disparity area in New York, but also really good data where we could actually have information for the government to make decisions based on. And then we also really talked about home visiting as a need to start to risk stratify home visiting programs and better target who they're serving. So I'll just kind of leave this here. I hit on basically all of these as enablers of success in terms of translating science into a state of the state type initiative. So the leadership from both health and education, learning from cross-sector efforts, using the opportunity of value-based payment reform in New York as an opportunity to talk about the long-term value of investing in young children, using opening up policy decision-making to broad stakeholder groups who can then become ambassadors for change and push those policy decisions through the legislative process, using groups that can do the hard work of actually writing policy and translating good ideas into Medicaid levers, and then always pushing cross-sector into every single proposal and not allowing funding to go out the door unless there is true demonstration of cross-sector work. Thank you very much.
Thank you, Suzanne.